Thanks, Jeff.
Hello, everyone. Welcome to our webinar this afternoon. We are just welcoming or waiting for people to get settled. We see the numbers going up in the attendees section. So if you've just joined us, welcome. We've been having a little chat behind the scenes, so we're ready to welcome you. Okay. So this is OARC's Webinar Wednesday, and this afternoon we're pleased to welcome guests from the Ministry of Long-Term Care and from the Office of the Chief Medical Officer of Health, who will be speaking to us about respiratory illness season preparedness. They'll also be answering your questions at the end of this presentation during the question and answer or fireside chat portion of this webinar that will be hosted by our very own resident advisor and OARC board director, Anne Donaldson. Hi, Anne.
Hello.
So let's get started with a land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today, from wherever we're virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us in our own way can move forward in a spirit of reconciliation and collaboration. One of the ways that I personally move forward in a spirit of reconciliation is to learn as much as I can about the people who are the original caretakers of this place where I'm located. I'm located in Toronto, and one of the groups that was here and that is still here is the Mississaugas of the Credit. And I spent some time, they've got a really great website. I've spent some time reading about them, particularly about health practices and disease prevention practices. So in anticipation of this webinar, where we'll be talking about preparing for the fall respiratory illness season, I was curious about how the Mississaugas of the Credit, what are some of their health practices? I won't list them all for you here, but things like ensuring that not only your physical health was taken care of, but also your spiritual, your mental health, your relationship with the land. So if this is something that interests you, you can go on to any of the websites for the local people in your area and read a bit about some of the traditions that that people used in the past and also currently today, because these people are still here and still reclaiming parts of their heritage and their past and present that may have been lost. It's just something to leave you with, a bit of a personal story about how I approached this. Okay, next slide, please. Thank you. So for today, you'll notice that the chat box is disabled, but we do have the question and answer box that is open. So we encourage you to submit your questions through the Q&A box, and we'll get to them at the end of the presentation. This webinar is being recorded, and a recording will be available on our website and also mailed out to all of our participants today. At the end of the webinar, there's an evaluation that will pop up automatically as soon as you close your Zoom screen, and we welcome your feedback and suggestions there. And without further delay, I'll pass it over to Dr. Mary Choi. Dr. Mary, welcome.
Thank you so much, and thank you so much for having us today. My name is Mary Choi, and I am a senior medical consultant with the Office of the Chief Medical Officer of Health. I have the privilege of working alongside my colleague, Dr. Daniel Warshawski, who's also here today, as well as my wonderful colleagues from Ministry of Long-Term Care as well. And I lead a lot of the planning and the response elements from the Ministry of Health side for public health units related to respiratory season outbreaks. So that is why I have been asked to present today. Next slide,
Mhm.
please. And next. So as you have, I'm sure, already started to possibly feel or have heard from your loved ones or heard in the news, it is that season again where we are expecting a lot of these respiratory pathogens or viruses to start circulating in greater numbers in our community. And this is, as you all know, that this is something that we see almost every fall and winter, predictably, as temperatures get colder. We spend more time indoors, we're all surrounded by one another, and it just makes it that much easier for us to spread germs to one another. And so these patterns, I'll show you in the next slide, but before I do, this is something that we typically see every year, year in, year out, except with a slight, except for the 2020, 2022 pandemic years, which I'll discuss in a second. As you will very well know, some of the symptoms, some of the symptoms associated with a respiratory infection, they can be anywhere from mild to severe and can include one or more of the symptoms listed on this slide. It's I know this is all a very much lived experience thing. We all know what it feels like to be sick, but I have included this really for completeness sake because it is something that the homes and your care providers will also be using to determine whether or not you'll need further assessment. Next slide, please. So this slide and the fun, colorful graphs are really for you and your loved ones if you're interested in poring over data like Daniel and I am. And really what this slide is saying is that what we're expecting to see this season and the way that we're planning as the Ministry of Health for this season is similar to what we experienced last year. That is to say, we expect there to be COVID-19 circulating. We expect influenza and other respiratory viruses to be around as well. One of the things, so I mentioned earlier that what we're expecting to see this season is that things are returning more to that typical respiratory season pattern, which means it's the number of viruses and the number of sick people around us typically increases starting in the fall. It peaks at some point in the winter and then it gradually comes down. That is the pattern we normally see. I mentioned a slide ago that this pattern was slightly broken during the COVID-19 pandemic years, mostly because of a lot of the public health measures that were in place, which were very good at preventing not only COVID-19, but the circulation of a lot of these other viruses as well. But as you know, as we're really returning back to our normal day-to-day activities and back to our regular lives, we are starting to see these patterns emerge again, which is really helpful for us from a planning perspective because it's just so much more predictable in this way. Yeah, so next slide, please. One of the reasons why we take an exceptional interest and we really do try to do right by you guys is because we have seen, and you have also experienced yourselves, I'm sure, that while long-term care homes are these incredible social, active, dynamic communities, and you do have a lot of, visitors and family and friends and loved ones come in and out, it also means that every person that comes into the home and leaving the home is potentially bringing a virus into the home, especially during the fall and winter respiratory season, as we see more of these germs circulating. And when one of the residents in the long-term care homes gets sick, it also means that typically we see more severe consequences or severe illnesses associated with infections. It might be easy for a toddler to be able to bounce back, but unfortunately, we're not all toddlers anymore. And even I haven't been sick in a couple of years. And when it hit me last week, I went down very hard. So these are some of the things that we're really trying to avoid and prevent by making sure that we have appropriately prepared for the respiratory season and putting in the right measures in place to prevent folks from getting sick as much as possible. I've listed the complications. They're very gloomy, so I'm not going to read them out loud and I will skip it, but we all know what the complications are, so I will move on. And so a lot of the measures that we do, it hasn't changed in decades and years. They're still the same ones that we have relied on during the pandemic, as well as before the pandemic. And these are things that we can all do when it comes to infection prevention and control. I have put in the slide, and I really do mean this. Everybody has a role to play to keep ourselves as well as our loved ones safe. And the things that the residents can do to make sure that you guys stay safe as much as possible and healthy as much as possible this season is to stay up to date with your respiratory season vaccine, which my colleague Dr. Warshawski will discuss. If you're feeling unwell, to notify either your loved one or your staff to let them know that you're feeling unwell so that they can start implementing the tests and the appropriate preventive measures in the home. Always washing your hands. This is very obvious, and I'm sorry that I'm repeating all of these things, but I have to say it because otherwise I would not be a good public health physician. But the basic things like washing your hands, covering your mouth and nose when you're sneezing, washing your hands after you sneeze, wearing a mask if you're able to tolerate it, and then are all things that go a very long way in keeping you safe and healthy. It's also very important for you and your caregivers to initiate a conversation with your providers and the home about what your goals are. So in the event that I'm sick, these are the things that are important to me, and these are the ways that the home and the care providers can make sure to keep in mind so that you're not nearly as miserable as possible, both from a physical as well as mental health perspectives. It's also about chatting with your loved ones and reminding them to not come visit you if they do have that incredibly robust toddler running around at home being sick, because it's going to impact you and your fellow residents in the home differently. So encouraging them to visit you after they're feeling better. And then, of course, during an outbreak, following the directions of the staff and public health. To make sure that, again, we're able to put those measures in place appropriately and prevent the germ from spreading further. Next slide, please. Couple technical things that I did want to point out. Again, many of you may already be familiar with this, if you've gone through the last several seasons. But what we differentiate in the public health parlance, so to speak, the respiratory infection is what a single individual, a resident, a staff, or a caregiver have after they've been infected with a germ and they start feeling sick. What we consider an outbreak, however, is when two or more residents, with some linkage between those residents, for example, they participated in a communal activity recently, they dined together, there have been some social activity that suggests that they spread the infection from one another. And at that point, we start to consider from a public health perspective that this is an outbreak of a respiratory infection. And what this really means is that the public health unit and the home are then prompted to make sure that appropriate measures, those additional precautions are in place to prevent further spread and to prevent others from getting sick as well. And during an outbreak, this also means that there are going to be very specific activities associated with that public health units will direct homes to do. And this will be things like asking others on if you're feeling sick, others on the unit with you to wear a mask if they're able to limit their activities. Again, because a lot of that socialization and the fun social activities, unfortunately, are also what's causing the spread of these germs, as well as making sure that some of the other factors, like maybe there was a staff who was feeling sick and they also contributed to this outbreak, making sure that that staff member is at home recovering and preventing additional exposure within the home. So there are going to be those measures that that public health units will be asking the home to implement in the home when this happens. And the homes are required to report all suspect and confirmed outbreaks of respiratory illnesses to their local public health unit, as well as the Ministry of Long-Term Care home. And that just enables us to be able to coordinate and have that situational awareness so that we're all on the same page as to what needs to happen. And
yeah, you mentioned that when two or more people, and we have an area, every area here has 32 residents.
yes,
And you say when two residents may have had dinner together, they may have gone to an activity together. What about somebody who's in this area with 32 people, they get sick, and the other one is at the end of the hall, and they never meet each other, and you're. I understand when you're saying that they go to dinner together, they play a game together, but not when it's from one end of the hall to the other,
Right.
when they're never together.
So this is part of what the public health units are asked to do. So when there are multiple individuals who are sick, and they all happen to be residents, the public health units are then asked to investigate, could there be a linkage? If there is a linkage between the residents, then this is when the outbreak measures go into place, and that will be implemented on the ward or the floor level. So again, to be able to prevent further spread amongst the residents. If there are no linkages as far as they can tell, and this really seems like two isolated incidents of illnesses, the residents themselves who are sick may be asked to stay in their room while they recover. But then, depending on the level of risk that the public health unit assesses there to be, there may or may not be additional measures implemented.
Okay.
Yeah.
Okay, thank you.
Anytime. Next slide, please. So I mentioned some of those things that we all can be doing. And so I really wanted to make this as practical as possible and really relate to what you yourselves can be doing to make sure that you yourselves are doing your part in keeping yourself and others healthy as possible. So during the respiratory season, and we all know what it feels like to have a cold or a flu. If you're feeling unwell, please notify a caregiver as soon as possible so that, as I mentioned before, they can get the testing arranged, they can get the medications arranged if needed, as well as implement those additional precautions. If you are feeling unwell, I can't imagine that you're really up to, going out and raising a ruckus. We do encourage that you do stay home in your room, stay in your room as much as possible, avoid communal activities, as much as your mental health supports you to be able to do so while you're sick, because it also, it helps to prevent spreading of the germs, but also because, you'll be able to get that necessary rest so that your body is able to recover. If you are receiving care, or if you do happen to be sharing communal space with others while you're sick, you are encouraged to wear a mask as much as possible so that you don't spread those germs. It's sort of kept within your mask, and you keep those germs to yourself. And then if you're feeling sick, a healthcare provider will typically arrange for you to get tested. It's usually a nasal swab. And then if you happen to get tested positive for either COVID-19 or the influenza virus, you may be offered medications to help you feel better sooner. Those are the two viruses that we do happen to have treatment for. And so this may also require you to have a chat with either the home or your healthcare provider just to make sure that you review your medication list. Sometimes there can be a little bit of interaction between the antiviral medications and the drugs that you may be taking, and we don't want those things to happen. So just making sure that you have that assessment and that checkup in place so that as soon as you get sick, it's pretty seamless from the home's perspective for you to get tested and then for that medications to be started right away. And then, as I mentioned, hand washing, respiratory etiquette. So I think those are all the slides for me.
Can I just, before you get rid of this slide,
Back.
the test for COVID, I understand. Do we have a test for flu?
Yes. So there are a couple forms that the testing may come. Typically, they'll all be swabbed from your perspective, but either the homes will have those little antigen kits or those little machines in the home to be able to test it right away, or they may be sending off your swabs to the laboratories like LifeLab, DynaCare, Public Health Ontario. If Typically, the little rapid antigen kits that we're all used to from the pandemic, those usually only test for COVID-19 virus. But if the home happens to have a little in-house machine, or if they happen to send the swab out to get tested through a laboratory, it will test not only COVID-19, but influenza as well as RSV virus, amongst others. So,
wow.
yeah, what a world we live in.
No kidding.
So without further ado, I will pass it over to Daniel.
Great. Thanks so much. Mary got all the exciting stuff to talk about. I only get vaccines, but they're very important. So we can jump to the next slide. And again, thanks for having us today. I'm Daniel Warshofsky. I'm one of the Associate Chief Medical Officers of Health in the ministry. And again, I'll be running through the main immunization programs that we have running for our respiratory season. What I want to emphasize up front is there are other vaccines outside of the three I'm talking about now that are really important to still get. All of the routine immunizations that we would have gone in childhood, people need to make sure they're up to date. In particular, for older adults, we have several other recommendations like your pneumonia vaccine, which is not a seasonal one. You get it from your doctor or routinely as just part of the routine schedule. It doesn't need to be given every year, but obviously hugely protective in terms of some of the seasonal illnesses that we talk about with respiratory disease. And we put the picture of Dr. Moore, our Chief Medical Officer of Health annual report this year because it was all about immunizations and the importance of immunizations that we have in this province. And we'll talk about some of the benefits that we saw even just last season from immunizations that we do have available. So next,
Right.
please. So we want to go through the timelines and starting off with our COVID and flu vaccines. These are the ones that we're probably mostly familiar with from quite a few years now. Certainly flu has been a very long time. And as a reminder, in terms of who is eligible and recommended, all long-term care home residents, staff, care providers, caregivers, all of the above are strongly recommended to receive both their flu vaccines and their COVID vaccines annually. Obviously, there's some difference in why. So for residents, particularly older individuals who might have medical conditions, really high risk for hospitalization or other severe outcomes. For staff and care providers who may not be otherwise high risk for those outcomes, there's the risk of transmission and contracting within the setting and then spreading to others. And we want to cover this from all angles to limit transmission as much as possible. But strongly recommended to get this seasonal fall flu vaccine for flu and COVID for all those groups. In addition, we'll talk about, but there is still the spring vaccine timeline for COVID for residents in particular, for high risk individuals for severe outcomes. And the rationale of why we have that again is slightly different. It's not because we're expecting to see additional transmission that happens as much, but the waning of immunity that we see is more prominent in people who are immunocompromised or older adults. So needing that other dose of the COVID vaccine in the spring is really essentially to protect them. Whereas for people who are younger or don't have those other issues, we don't see the waning immunity happen as fast. They would still have protection in the spring, so another dose doesn't provide as much benefit. Both these vaccines for COVID and flu are updated every year to cover the newest strains that we see circulating. So again, we say COVID, but also the flu vaccines updated to match the strain as best as possible. For COVID vaccines, again, since there might be doses multiple times a year, the important thing to note is it has to be at least 3 months since the last vaccine or confirmed infection. And that's not because it's dangerous to get it closer together, to be clear. It's because we don't see a good effect of the vaccine if it's less than that time. You still have a lot of circulating antibodies to the previous vaccine and infection, and so you actually cannot respond as well to the newer vaccine and don't get protection the same way. So we want to make sure those 3 months have passed for COVID vaccines. For flu, there's no way anybody could be within 3 months because we don't have them for this much during the year. So it's just get your yearly vaccines. In terms of timelines, these are available now. So we usually get the vaccines coming to the province in late September. COVID comes like a week earlier than flu vaccines. But as soon as they come into the province, they start going out to our highest risk settings, which are hospitals and long-term care homes for those staff working in those centers, for caregivers and for the residents. So for homes, these are all available now. As soon as we have more, that's when it starts to become available to the general public at every pharmacy and every primary doctor's care physician's office, for example. That's probably in another few weeks, but for now it is broadly available for these high-risk populations. Next slide, please. The other vaccine I want to talk about, which is newer, so it's been a couple years now for long-term care home residents, but it's been expanded since that time, is our RSV immunization. And it's different for a few reasons. Number one is the effectiveness is probably even higher than we see for COVID and flu because it doesn't have to try to catch up with the strain every single year and match it. But number two, it lasts multiple seasons. So while it is still a seasonal vaccine in the way it's providing protection against the seasonal illness we have now, you don't have to get it every single year. We have excellent data and recommendations from our National Advisory Committee Immunization that we have at least 3 to 4 years of protection from getting a dose. So anyone who got it in our first season, which would have been 23-24, so oh gosh, 2 years ago already, when we had the first program start off, is still protected and does not need another dose of RSV vaccine. The big change this year is not to high risk eligibility. It was for community dwelling individuals age 75 and older, are now all eligible. And that's partly because last year we saw a huge increase in hospitalization related to RSV infection in the province. That was driven again primarily by community dwelling adults. And what we actually saw was that for long-term care home residents, we actually had lower rates of outbreaks than even the season prior and lower rates of infection overall. So I think that that is just a really great evidence for us of how well the immunization program is working in long-term care homes, which is even though we had the worst RSV season, in the last 10 years, certainly, for older adults living in community, we actually saw a better season than even the year before for those living in long-term care homes. So really a testament to how well the program is working, and of course the wonderful IPAC and everything else being done in homes. Ian, go ahead.
I see the Pfizer's there. What's GSK?
So those are the two different RSV immunization products we have. So this is not the COVID one. Sorry, those I have on another slide. I can go over
Oh,
those
okay,
too.
okay. Sorry,
Um,
my bad.
no problem. So for RSV, there's Arexvy, which is GSK, and Abrysvo, which is Pfizer. They've both been available in previous years. They're both considered equivalent in terms of protection from NACI, so we have no concerns with either product. I think my slide on the different COVID and flu vaccines might have been taken out, but I'll talk to them now since you asked about it. For flu, we have multiple different products. The important thing to note for older adults and long-term care home residents is there are two different what we call enhanced flu products. There's the high dose, which I think many people are familiar with, and there's one that's called adjuvanted. Both of those provide significantly better protection than the standard flu vaccine. NACI right now, so our National Advisory Committee, does not have a preference for one or the other between the high dose or the adjuvanted. So whichever one is quickest available is the best one to choose. Um, Again, we just don't see a difference between them right now, but they are both better than the standard dose, and either is recommended for residents of long-term care homes.
Okay.
For our COVID vaccines, we similarly this year have both Moderna and Pfizer. We don't have Novavax this year. It's not available in Canada, unfortunately, just because of manufacturing issues. But Moderna and Pfizer are both available. Similarly, NACI does not recommend a preference between either product. So, historically, there have been maybe this one's a little better for this group or this one for this group. We don't see that anymore, just given the number of vaccines that most people have gotten. They're both considered equivalent. They both cover the same new strain of COVID for this year. So either product, again, whichever is available soonest would be the preferred.
But I was told that if you had Moderna to start, that's what you should continue with, not mix Pfizer and Moderna.
We don't have those issues anymore. So you've taken me right to the next slide, Anne.
Sorry.
No, that's perfect.
We're myth busting today.
So um, earlier on, certainly there was that recommendation for a couple reasons. Mainly, it was because of clarity around how many doses you need and the protection you get. Again, the main thing is given where we're at now, we don't need that same sort of nitty-gritty in terms of you got Moderna, only Moderna going forwards, or vice versa. Either one still gives a very robust immune response, and we've shown this with both in every combination of which you've received at this point. The other thing is to note, of course, you can give them at the same time for any of these products. So whether it's flu, RSV, COVID, or your pneumococcal or whatever, you can give them all at once to the same person. And what a quote that I like to use, Dr. Alison McGeer uses one a lot, is we're all very comfortable giving 4 vaccines to our babies at one given time. Why are we so concerned about doing that for older adults? Which is we're not. We can happily give them at the same time, whether it's infants or older adults, and we see the same in terms of safety and effectiveness of those products. I think that the main thing to note is multiple vaccines in the same arm does slightly increase the risk of a sore arm and local side effects. That's the only, in terms of safety change that we see, not for severe outcomes, but just that local reaction. And so that's probably a reason why many people want to space them out more in the season. I think that, and again, there's no concern in spacing them out. And we know certainly in long-term care home, a lot of people prefer to do that. I want to make sure the biggest thing though is that you get them in before the season starts. And I think that's our number one concern.
Well, we had last year when we had something similar to this, we were told we were told the same thing. You can have them all at the same time. And one of the questions that I had or somebody had was, well, if you get them all at the same time and then a day or two later they get sick, how do you know which one caused it?
Yeah, great question. So when we had the RSV vaccine brand new, we were actually saying space them out a couple weeks because we were still, when a vaccine goes on the market, we still want to watch extremely closely to see what side effects come up. The fact is, for all these vaccines now, we know very, very well what the side effect profile is, that we don't need to monitor as closely. And most people will have gotten a COVID or flu vaccine already. So if they were going to have a severe reaction, we would already know from a historical one. If they've, by some chance, never received a COVID or flu vaccine in their life, that's a good reason potentially to space them out so you know, okay, maybe they had a reaction to this one, but that's extremely unlikely in most individuals this age. And so at this point, it doesn't really matter which one caused that reaction because we know you've already been able to safely have it for many years. We don't see sudden changes in terms of now you become allergic to it, for example, which is really the number one thing we're looking out for with these vaccines is an anaphylactic reaction.
Mm, okay.
Next slide, please. I think that might be my last one. Is that my last one? Oh no, I have one more. I thought so. Um, sorry. Um, so respiratory infections, as Mary's gone through, just generally are all more common in the fall and winter. So even when people don't look potentially sick, it might just be a mild sniffly nose. It's still very, very easy to spread these infections amongst different individuals. So all of the layers of protection that we talked today are really essential to manage in the season. We get questions all the time. I get them on every time we're speaking to primary care, which is, well, when should I start masking for this season, for example? Because these are really effective measures to protect ourselves and others. So, as Mary said, wear masks when we get into the respiratory season. We probably have a little bit of time now. We aren't seeing really high rates of anything yet, thankfully. So we're still very early on in the season, but usually by mid-November, we're well into the thick of things. And so having those measures in place is really essential, whether it's masking, hand washing, getting your immunizations in advance. These are all things we can do to protect. It's
Right.
it's really important as well, following obviously direction of the home and local public health if there's an outbreak or cases identified, because we want to limit the spread as much as possible and ensure, importantly, that everyone is able to get treatment as quickly as possible to avoid those severe outcomes, potentially prophylaxis, as Mary mentioned, if it's a flu outbreak, we'd be giving people prophylactic and antivirals to make sure they aren't getting sick and aren't going to spread further. And then again, staying up to date. So the three main ones I talked about today, flu, COVID, RSV, those are our seasonal ones a little bit more, although RSV doesn't have to be given seasonally. It can be given anytime because it's multiple years protection. But the other ones we need to give at this time to ensure they cover the whole of the season. That's the primary three viruses that we see in the season. And so we really want to protect against those, but not to forget, again, those routine ones like your pneumonia vaccine, and making sure you've gotten the most up-to-date ones so you have that protection broadly. For those vaccines, again, you can get them all at the same time. It is safe to do so. It is safe to space them out if that's preferred. Again, as long as we get them in before the season starts. And that timing is really the important thing here because it does take 2 weeks to get protection from your vaccines. That's the time for your immune system to build the response. So for all residents, COVID, flu, RSV are all recommended. Similarly for staff and caregivers, COVID and flu are strongly recommended. Not the RSV one for that population because it's different in terms of protecting against transmission. So really, again, emphasizing the importance of all these vaccines and limiting. And again, the data we have from the last year really shows how effective this has been in the long-term care home setting.
What about the pneumonia shot? Is that recommended for a specific group or at a specific time? Or
It's
does the home
recommended.
just ask for it?
Yeah, so it's recommended for everybody over 65.
Okay.
Broadly, that's number one. And certainly for anybody living in a long-term care home, it's recommended. The type of vaccine was just recently updated. So we actually just as of last year got a new one that's much more effective than the two that we had before and covers even more strains of pneumonia. It now covers 20 different strains in one shot. So it's
Wow.
very effective at reducing hospitalization from a broad range of different types of pneumonias that you may get. And so if someone hasn't had that new one yet, then they should really be following up with, their primary care provider or within the home to talk about, am I due for this one? When was my last pneumonia vaccine?
Yeah.
Making sure they have the most up-to-date one. It can be given anytime. Again, it doesn't have to be given during the respiratory season. It lasts multiple years for protection. But if they haven't had it, absolutely to get it now.
Okay. Because we've been offered all sorts of shots and haven't. I've had to sign all sorts of papers, but I don't remember the pneumonia one.
Yeah, we have a lot to offer now, particularly in the last few years. It's been the menu has been expanding, but again, it's really really helpful. And yes, pneumonia is not considered a respiratory seasonal vaccine. It's a routine vaccine, so it comes up often at different times in discussion. But strongly recommend people ask about it.
Okay. Great.
I think those are all my slides. So back to
Oh,
Jackie, I guess.
Well, thanks so much, Mary and Daniel. Lots of great information, and thanks, Anne, for jumping in with those questions. I think a lot of us were thinking them when you asked, so thanks for jumping in. This is the fireside chat portion now of this webinar. We've been keeping an eye on the Q&A box. Nothing has come through yet, so either everyone is really, oh wait, here's one. Spoke too soon. This one is from Stephen. Stephen, I'm gonna ask if you could enter it again. I think it got cut off.
is the
It's
coronavirus.
yeah, so we'll wait for you to pop that in.
Well, well,
Sometimes,
well,
yeah, go ahead, Anne.
I was going to say while we're waiting, I can ask a couple of questions that I have here. Is how can residents protect themselves from respiratory illness?
Getting vaccinated, I think, is probably what Danielle and I would agree is the most important thing you can do. Um, as and also and Daniel briefly alluded to this, but it's really not about whether or not the vaccines will protect you from getting infected in the first place. It really is about really preventing you, keeping you out of the hospital and preventing those really severe illnesses. So that would be absolutely number one thing from our perspective. And then the other things that we mentioned were the things that were in the little cute slide with the pictures, things like wearing a mask if you're able to tolerate it to keep yourself safe and create that barrier, that literal physical barrier between you and the germs that are floating around in the air around you, as well as washing your hands, letting a staff or a caregiver know as soon as possible if you're feeling sick so that you're not mingling with your healthy neighbors. And then really encouraging those visitors, your loved ones, your family members, your friends, letting them know that they really shouldn't be visiting if they're feeling unwell. Again, to prevent spreading of the germs in the home.
And if I can add a little
Yeah.
bit to Mary, which is obviously we have a lot of vaccines now, but they don't cover every possible
They
respiratory
don't.
infection. There are a whole bunch that,
Yeah.
particularly if you're younger, you get mild cold symptoms with, but which can be more severe, like the rhinoviruses, seasonal coronaviruses, like not COVID ones, other ones that can cause more severe infection, someone who is older or has other medical conditions. So these measures on the slide here are really essential to protect against all of those, in addition to the ones where we have really good vaccines.
Okay. What might you say to somebody a resident who says, I'm not going to have any of the shots. I don't want any of the shots.
I can start. So it is a question that comes up fairly often, particularly for COVID and flu vaccine. We know because it's a yearly vaccine, a lot of people get what we call vaccine fatigue. So not so much that they're hesitant to get it because of it, just, oh, do I really need to get it every single year? Is it that important all the time? I think there's a few things that we talk about to try to emphasize that. And number one, I'll say is it's often a long conversation to have because there's lots of questions. But number one is, yes, we get it every year, but that's because the viruses change every year is number one.
Mhm.
So for both COVID and flu, the strains change every year. I think we can all remember back in COVID when every day we were on edge, like, oh, is there a new variant that's coming out? Obviously, it's not to that same level anymore, but we have changing COVID and flu strains all the time. That's
Mhm.
why we see these viruses every single year. If it was the same one, we'd all be immune already from the last time. We wouldn't even see them coming. So
Right.
we 100% see changing. So unfortunately, the protection from having it in previous years just doesn't last because of how quickly these viruses change. The other thing is that, even if you yourself, again, let's say you're not someone who is older or is necessarily at risk for hospitalization, is they protect you from spreading to others. And that's a
No,
really important message.
I
So,
agree.
I'm a healthcare worker. I work in the hospital days per week, and I make sure I get my flu and COVID vaccine every single year because not that I'm going to end up in hospital, that's unlikely. I'm younger, I don't have medical conditions, but I'm going to see people who are older, who may be immunocompromised, who may have other medical conditions. And even though none of our vaccines are perfect, it's going to significantly reduce the chance that I'm going to catch one of those and then spread it to someone else who might get it. And we all want to do our best to protect our loved ones, our friends, our family, our community with it. So I think those are the two kind of key messages I have, which are protecting yourself because they just don't last, and then protecting everybody else.
Well, I think that's why the ad on the TTC bus was so good was I'm wearing this mask to protect you, not me.
Exactly.
Yeah. Um, thank you. Are there new COVID strains anticipated this fall in Canada? I think you've already answered that in as much as they're coming all the time.
They are. So, there's a whole alphabet and number soup for the naming of them. For anyone's interest, we can put the link of what's there right now. So the strain that we had last year is not being seen right now. We're seeing what's called the XFG strains predominating in Ontario and the Northern Hemisphere broadly right now. Again, these are different enough that like last year's vaccine is not particularly effective against it. The new vaccine that we have available is much better in terms of protection, and so it is important to get that updated one.
So would it be safe to say that the flu shot is based on last year's flu? Is what I understand.
Not quite, but
Oh,
close. So what we actually do is follow globally the trends. So the flu shot that we see is often based on what we see in the southern hemisphere. And so we make sure that we can turn it around as quickly as possible to cover those strains. As best we can tell right now, we had a pretty good match to the Southern Hemisphere strains that were circulating. Nothing is ever perfect. You never know if there's a sudden change in what comes up, of course, so we monitor closely. But from the data we have, it looks like it's probably going to be a good match for this season. Again, fingers crossed on that one a little bit.
and the same applies then when you come up with the COVID boosters, the same kind of idea.
Exactly. Yeah, we look at what's globally circulating and then do it in time to try to get it in as close as possible to when the season starts, but enough time to manufacture it. So obviously it takes time to make millions and millions of doses.
Yeah.
So usually the strain is picked kind of in the late spring to decide we think this is what it's going to be. And then they roll it out as quickly as possible. And again, for COVID, what we know right now is we still have a good match based on what's currently circulating.
And it's quite a little off the subject. Do
Sure.
the shots did they get made in Canada? The vaccines?
No, it's a great question. Some of them do. Obviously like as I showed, there's different manufacturers and different specific ones that we have. A number of them are manufactured in Canada. Some of them are manufactured in other locations globally. Some are made parts of it here and they come to Canada and they fill it and do the finishing. There's a whole difference of it, but we do try to get as much Canada manufactured as possible, given
Mhm.
both obviously support for our country, but just timing of getting the vaccine in time. If it's already here, much easier to get it at the start of the season.
And who pays for the vaccines? Do you pay for it? Does the government pay for it?
Yeah, so the Ontario government purchases all of the vaccines for
Okay.
Ontario residents. It's not something that's done federally anymore. So during the pandemic, the federal government purchased our COVID vaccines. That has since ended. So all of the vaccines that are publicly funded in Ontario are purchased through the Ontario government.
Oh, okay. Good to know. Are there any updates on prevention? I think you've covered that too. Probably is.
Great questions, Anne, and really great answers too. I'm just looking at the Q&A box again. We have an updated question from Stephen, again about the vaccines. So we have our group is very interested in vaccines today. You mentioned the two that are available for COVID in Canada or in Ontario right now. Are those still the mRNA vaccines? Or Stephen's asking, is there an actual part of the coronavirus in these two vaccines?
Yeah, so it is still the two mRNA vaccines. As I mentioned, so Novavax was the protein vaccine. That one's not available this year again, unfortunately. The mRNA vaccines, again, they don't have like a piece of virus in them. It's not that simple. So both the protein vaccine or mRNA vaccine fundamentally work in the same way, which is at some point they're presenting that protein from the outside of the coronavirus to your cells to identify and fight against. In the Novavax, the protein vaccine, they're just giving the protein. There you go. In the mRNA vaccine, they give the code for the protein. Your cells then make some of that protein, and then they identify the protein afterwards. So it's the same mechanism, just with an extra step for the mRNA ones, essentially. So it's not giving you a whole virus. There's no live virus involved, anything like that. It's the one very specific part. If we can remember, we have on the pictures here, if you can see on the top left, the circle with all the little line dots and sticks coming out of it. It's those sticks that your body needs to recognize to be able to understand that's the virus I need to target it.
Thank you.
So
Thanks for
it's up to your body to be smart, in other words.
Absolutely.
Got a bit of a microbiology lesson here for free. Good question, Stephen. We do have another question from Mary, who is asking, if you guys remember a few years ago, there was this recommendation that if you had recently had a COVID infection, that you not receive the vaccine within a certain time frame. So Mary's question relates to how the testing is more limited now for COVID. So is it possible, or have you heard of there being a reaction to receiving the COVID vaccine if someone has recently recovered from an infection, but perhaps didn't know?
Yeah, and I touched upon it just briefly, so I can have the opportunity to expand now. So first off, the testing should not be limited in a long-term care home setting. I just want to upfront make that very clear. But yes, it is a little bit less accessible in the general community now. But no, it's not a safety issue with receiving it sooner. So again, we still have that minimum 3-month recommendation between your last vaccine or last infection and your next vaccine. And again, it's not a safety issue in that you'll have a bad reaction. It's the vaccine just won't work so well if you get it too soon. So you'll still have antibodies to the last vaccine or last infection circulating. And so you can't respond to the new one, unfortunately, if it's been so close. We need to give a little bit of time and space between it so that you can get the best possible protection from the new one. So that's why that recommendation is there. Again, not a safety issue. So as I said, if it was given, we wouldn't be concerned. Like if you got it at 2 months, it's okay. No one's worried. It just means the protection won't be as good as it could have been if we wait a little bit longer. So hope that helps.
Thank you.
If we had in here, in this place, we had one person in this floor got sick. And then I got sick, and then somebody else got sick. And there were about 6 or 7 of us that were quarantined, and that's fine. But they decided they'd run a test and see, where the problem is. They did a swab on everybody that was not well, but they only gave results for the first 4 swabs. I wasn't one of the swabs that was tested. Mine wasn't one of them that they did. And yet I had completely different symptoms to everybody. Is the government still doing that, or is it still saying we're only going to test a certain amount if you have an outbreak?
So typically it still is the first 4 symptomatic individuals in an outbreak. And the rationale for that is if you guys, if there's a virus that's spreading in the home, what we would typically see is everybody getting the same thing. It's the same germ that's going around. And so the yield of additional tests it's just not that you don't really get the bang for the buck if you're testing every single person. That being said, we do encourage homes and public health units to work together if they feel like there's something off and maybe one patient looks a little bit different, as you said in your case with your symptoms, or something doesn't fit the
Yeah.
picture that's
Yeah.
that currently exists overall, then we do encourage them to arrange for testing. There is a mechanism that will enable homes and public health units to actually call up the lab and say, hey, this is what's going on, we'd like to set additional tests, and usually they should not have a problem with that.
Okay.
Yeah.
That's good to know, because they couldn't, they said they just couldn't do it here, and I thought that's just wrong.
Mm. It's really the lab-based test. So if you guys do have those rapid antigen testing kits in the home, or some homes have a little machine at home that runs the tests as I mentioned, those shouldn't be limited to the first four. So there is a little bit of variation across homes as well.
Okay. How do we get one of those machines in here to do the test? We
I'm
had
not sure.
one, and then we had one, and then they took it away.
Oh no.
Well, it was apparently for a few months.
Oh,
I guess we were one of the testers.
I think you might have been one of the testers, and I think that's really the situation in which those little machines exist.
Oh,
Yeah.
okay.
I think we're still learning more about them, and trying to get a little bit more experience in these sort of one-off testing sites, to see if they're nearly as reliable as some of the other forms of testing that we use.
Well, here it worked beautifully. And that's why I said, how can we get another one? Because it's right away. You don't have to wait for it. It's
Yeah,
just
that's the
on the
benefit.
spot. Yeah.
Yeah. So we've got a couple, just two more questions before we wrap up for the afternoon. Thanks so much for your time and for your thoughtful responses so far. One is about vaccines again, so about alternatives to the mRNA vaccine for anyone who might be allergic. This question is coming from someone who's got a neighbor who is allergic to the mRNA vaccines. And then the next one, the last one, is about it sounds like the antivirals. So if you're unable to get vaccinated for whatever reason, how does the use of antivirals, what does that look like?
Yeah, I can start, and Mary, jump in anytime. So for the vaccines, so yes, some people are allergic to some of the ingredients. It's not the mRNA component, it's one of the other ingredients in the vaccine that they'd be allergic to. Although it is pretty uncommon for these vaccines, it does happen. We only have mRNA vaccines now, but again, they're two different brands and they have different ingredients. So if you're allergic to one, you may not be allergic to the other, which is why it's important to know which one they've received before, because it's not that all the mRNAs are the same, it's the specific ingredients. So we don't have another type of vaccine, but again, between the two vaccines, it's pretty uncommon to be allergic to both of them. Like that would be very, very rare. So just ensuring that they check and make sure which one and what the allergy was like is the first thing. There are, again, some people who might be absolutely allergic to both. It happens very rarely. In that case, unfortunately, they can't get a vaccine because they have that bad reaction. Then all the other measures we've talked about are doubly as important, and certainly for the home to be aware of who's at risk so they can be monitored more closely during the year. In terms of the next part, which I think comes at the last one, which is, well, if you couldn't get the vaccines, what else is available? And again, to emphasize, vaccines are still the best. They are better than the treatments that we have up front. I just want to be clear about that one. So if you can get the vaccine, that is preferred. We do have, as Mary mentioned, a couple different antiviral treatments. One's called Paxlovid, which is a pill by mouth. One's called remdesivir. It's an IV injection that you have to get. They are both effective at reducing hospitalization from COVID infection. You have to start them really fast after you get symptoms. So within 5 days to see the benefits. So hopefully that can happen. But they can also significantly reduce the risk of going to hospital if you've had COVID. So it's there as an extra. Even if you've been vaccinated, we'd still recommend it for a resident of a long-term care home or someone else who's high risk to get that treatment. So it's really important that prior to any infection happening, that discussion has already been had with your doctor or nurse who will be prescribing it, to make sure, yes, I know what it is. I know what the risks are. I'm absolutely ready to get it. There's a prescription on file. We can get it ready to go as soon as possible so that you can get it in. And I know the question about COVID, but since we're also talking about flu, I'll add those on. Similarly for flu, it's the same. There are antivirals for flu. They have an even tighter window than COVID, which is only 48 hours after symptoms. And if you don't start them within 48 hours, we don't see the benefit of them. So even more important for flu to have that discussion in advance, make sure you're aware, have the prescription on file so that things can go really, really quickly when the symptoms start.
Is there any thought that they're ever going to have a shot for the common cold or the rhinovirus?
Oh gosh, wouldn't that be wonderful? They are working on it. We haven't seen anybody come up with something effective yet, but there are more every year, right? So the RSV vaccine is new in the last 2 years, right? We just got it. We keep getting more and more. So our fingers are crossed that that one's on the near horizon.
Okay.
Thanks very much, everyone from the ministry and also from the Office of the Chief Medical Officer of Health. It's so great, as always, to have you here answering the questions. The questions get tougher every year, I find, but your ease of answering them also gets better every year. So we really appreciate you spending this full hour with us. And thank you to you, Anne, for moderating the questions so well. You've got some new fans in the question and answer box wanting to know who you are. Apologies for not giving Anne the intro that she deserved. Anne is a person who lives in a long-term care home in Ontario, so that's where her know of the word on the street, so to speak, comes from. Her lived experience as someone who lives in a long-term care home. She's also a director with OARC's board of directors and a resident advisor for OARC. I hope that answers your question. We'll see you all again next fall.
Before we go, if I can just say to the both of you who talked about this, there was absolutely no hesitation when you came to answer. And I personally find that absolutely outstanding. So thank you.
No, thank you so much for having us. We're always happy to be here and to share and really hope it helps.
Yes, thank you. And thank you for your facilitation, and it was great.
You're welcome.
Okay, wishing you all a great afternoon. Stay safe, keep those germs away, and if you have some time, please fill out the evaluation that's going to pop up on your screen so we could share with our lovely presenters and with Anne and the team at OARC. Thank you so much. Have a great afternoon.
Thank
Thanks,
you.
everyone.
Thank you.
Everybody.
Bye.
Thank you.